Welcome to the latest edition of Vaccines Research Updates, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. Data Cancer Genetics challenged the CDSCO denial of Phase 1 for Per-C-Vax. The Bombay High Court directed a CDSCO appointed 9-member expert panel, expanded with 2 nominees, to review the company's submissions and report within 3 months, which could influence pricing and formulary access. WHO's SAGE position paper lists the MAV-06 Varicella strain alongside OCA and endorses interchangeability in 2 dose schedules. GC Biopharma's injectable Varicella is already supplied via PAHO, supporting broader procurement and access. Observational analyses in Wales and Australia linked shingles vaccination with a lower incidence of new mild cognitive impairment and reduced dementia mortality over follow-up periods of up to 9 years. These are not randomized trials, so causality and vaccine product specificity cannot be confirmed. The BPZ-E1 intranasal live attenuated Pertussis vaccine generated robust mucosal and systemic immune responses in early testing, led by the NIHR Southampton team, aiming to reduce carriage and transmission beyond infant protection with current cellular vaccines. Vaxcyte dosed the first participants in OPUS, an approximately 4,000 participant FDA-aligned Phase 3 non-inferiority study of VAX-31 versus Capvaxive PCV21 and versus Prevnar 20 PCV20. Primary endpoints use opsonophagocytic activity geometric mean ratio, non-inferiority on shared serotypes, and superiority on VAX-31 unique serotypes, with safety and tolerability, and top-line data targeted for the 4th quarter of 2026. GC Biopharma shipped initial doses of injectable BARYTHRAX, the first recombinant anthrax vaccine using purified protective antigen, to the KDCA national stockpile. Facility capacity is up to 10 million doses per year for a 4-dose regimen. Peptinov PPV-06, an interleukin-6 vaccine for knee osteoarthritis, reported Phase 1 double-blind results in 24 participants, testing 10 micrograms and 50 micrograms versus placebo. The vaccine was well tolerated. All treated participants developed anti-interleukin-6 responses, and functional improvement was observed at week 42 in fully dosed patients, with Phase 2 planned for 2026. Osivax fully enrolled 2,850 adults across Belgium, France, Finland and Germany in the Asuniva OVX836 Phase 2B. A single 480 microgram intramuscular dose is being evaluated, with efficacy readout expected mid-2026, contingent on seasonal influenza A circulation. Stay ahead in vaccines research, like, share and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.